name is Brooke Hale, and I will be presenting about canine parvovirus today. Canine parvovirus can be very deadly. About 80% of puppies die from canine parvovirus if not treated correctly. However, 85% of puppies will be able to survive the virus if they are treated with the correct treatment and fluids. Some symptoms of canine parvovirus are abdominal pain and bloating, some diarrhea that may or may not be bloody, vomiting, lapse of appetite or refusal to eat, and low body temperature or fever. However, it's hard to tell low body temperature of puppies from touch because dogs run about 102 to 103 degrees Fahrenheit for their normal temperature. However, if a puppy is not wanting to eat and is vomiting all over the place and very lethargic, it's a good idea to go get the puppy checked out and maybe tested for parvo. Treatment for parvo is actually pretty simple. Although parvovirus is in fact a virus and that cannot be treated with antibiotics, antibiotics do help to prevent other symptoms or diseases to come up. However, the best way to treat parvovirus is with IV fluids that are infused with B vitamins and C vitamins, because these vitamins help boost the immune system and bring the dog back up to normal health. Glucosamine is always a good idea to have to coat the intestines, whereas colostrum is able to provide antibacterial elements to help fight the infection within the gut. When dogs are having severe vomiting and diarrhea, the guts can get very irritated and even bleed a little bit. So therefore, it is good to be able to treat this early on. The IV fluids, however, are very simple to get in. However, you may need a e-collar to help keep the dog from chewing its IV or tangling itself up and that kind of thing. Even though these puppies are very lethargic, once they start feeling a little bit better with all these medications, they can be pretty wild. However, the easiest way to treat parvovirus is to prevent it completely. Puppies are required to get 4 sets of vaccines during their first 4 months of life. During their 6 to 8 weeks, they should receive their first DA2PP, which is a distemper, parvo, and a couple of other viruses composed into one to help form the antibodies in the puppy's system. However, puppies are very growing fast and they get rid of antibodies and receive antibodies very quickly, so therefore you need to booster the vaccine every 3 weeks. Between 6 and 8 weeks, 8 and 10 weeks, 12 and 14 weeks, and then 14 and 16 weeks. And during the 14 and 16 last round of shots, the puppy will receive his distemper, bordetella, and rabies. However, if you do miss all of these, you will want to get your puppy boosted even if you're already at 16 weeks. Other ways to prevent the parvovirus is to limit your dog's exposure to unvaccinated dogs. If you have a really young puppy, it's a very good idea to avoid dog parks, PetSmart, those kinds of things. That way your dog doesn't get in contact with any saliva or anything where it could pick up the virus from a parvo dog. Parvo dogs may not show symptoms at first, so a dog who may be coming down with parvo might go to the dog park, walk around the neighborhood, that kind of thing, and still put out that virus until it gets affected. Avoid any areas where you know parvo has been exposed. Vet clinics are horrendous for having parvo exposure, obviously, because that's where you take your dog to be treated for parvo. So when you're taking your puppy in for vaccines, it is smart to hold the puppy and not really let it touch the ground, because although there are very sanitary conditions, there's always that risk of parvo being spread. And also, if your puppy is starting to have any diarrhea or extreme vomiting or any lethargy that is abnormal, it's always a good idea to immediately take them to the vet and get everything checked out. I got my works cited from vetinfo.com, which actually is very helpful. They have some pretty trustworthy sites and information on there, but I also got some information from 1-800-PET-MEDS. And my third site I couldn't really put on there is I work at a vet clinic, and I actually come in contact with parvo on a daily basis, and we learn how to treat and care for these animals while they're battling off this virus. All right. Thank you so much for listening to my presentation.